All right. So I want to just give a big warm welcome to everybody who has joined tonight for a consumer training that is co-hosted by Healthy Planet. So thank you to Healthy Planet and Now Foods Canada. I am Talia Charney, and I will be doing the talk for tonight. I'll more formally introduce myself in a second, but just a few housekeeping things before I get going. Firstly, we have a lovely moderator, and that is Sylvia, who will be looking at any comments and such that you have in the chat. So for comments, if you want to share ideas or just ask some questions to the moderator, you can do that in the chat, go ahead. But there will be questions at the end. So I'll talk for about 45 minutes and then I will take questions. So if you would like me to answer questions, then please ask those questions in the Q&A, not in the chat section. So I'm going to check the. All right, so hopefully that'll make sense. And you will all get an email with the recording after this tonight, so you can re-listen to it as many times as you want, and Healthy Planet also puts it on their YouTube channel. All right, so I think I've said everything I need to. I'm going to get started. So this talk this evening, oh my, not another UTI, is about urinary tract infections, and I hope that you get a lot out of it. So just as a quick introduction, I'm Talia Charney. I'm the Nutrition and Health Education Manager for Now Foods Canada. I'm also a holistic nutrition and wellness coach, an author, an educator, and a speaker. But my true love is, as I'm doing tonight, and training, and my training values, which I really hold close to myself, are honesty, objectivity, nuance, and humility. Always got to do a disclaimer. So just important to keep in mind that these presentations are for informational purposes only. So they don't constitute the practice of medicine, nutritional counseling, or naturopathy. That means that the use of information written or stated here, or materials linked from here, and of course also questions answered at the end, are at the user's own risk. If you want to know anything about the suggested uses, doses, or cautions of products that I will mention as we go through this presentation, although the bulk of it at the beginning is just other background information on the topic that I think you'll find interesting. But you can find these always on the products themselves. You can go to nowfoods.ca. All right, so just by way of, if anyone is brand new in terms of to Now Health Group or Now Foods Canada, I just want to quickly mention a little bit of background. So Now is a family-owned company, 54 years old, if you can imagine. We are 4 generations family-owned. We celebrated our 50th anniversary a few years ago. For anyone who knows us, they will think quality. We have 8 labs, high-end labs, where we do an average of 16,000 quality tests on a monthly basis. Here are some of our Now family staff and scientists hard at work. So just as one example, we can test for over 500 pesticides alone. And we have a rating, which is the highest rating for good manufacturing practices for 20 years, so since the inception. But for the first 8 years of those, we actually voluntarily were audited because it was not a requirement back in the day. And actually, we were, the smaller Now family and the founder, on one of the initial boards and organizations that pushed and gave governments the incentive to bring good manufacturing practices to the health industry so that we can all raise our standards. Nope, you don't need to see that twice. All right, so let's dive into starting with the background on UTIs. I'm going to get this laser here so you can follow me a bit. So a urinary tract infection is an infection that can occur anywhere along the urinary tract. So I just wanted to make sure that you understand what that is. So the urinary tract includes the kidneys. So our blood is filtered through the kidneys, and then this creates the urine. But it's an infection in the kidneys. It could be in the ureters, which are little tubes that connect the kidneys to the bladder. So it could be an infection in the bladder or in the urethra, and that exits down. So kidneys infections, of course, are quite serious, and you're likely to be in a doctor's office, hopefully, if you have a kidney infection. If you've had a physical exam in the last few years, if you ever remember, I don't know even if medical doctors do this much anymore, but anyway, usually put their hand on your back and bang like this, or just right behind your kidneys, and that is a check to make sure that the kidneys are not inflamed. So if they suspected a kidney infection, they'd be doing that. But most often, if you're getting chronic UTIs, it's going to be in the bladder, and that's called cystitis. But for men, it could be also infection in the prostate, which is part of their urinary tract. So here's the bladder of a man, and then the prostate sits on the sides of that urethra, which runs out. So when they get an infection in this area, it can really restrict the flow of water out, and that's called prostatitis. I will be mentioning that a little bit and one product at the end, but by and large, I'm going to be referring to bladder infections, and that's what cystitis is. So how do we know if we have a urinary tract infection? Well, these are common signs and symptoms. Now, if you have blood in your urine, I don't have to tell you, you're going, right to maybe the doctor or the emerge. So that's kind of obvious that something is wrong. But there are other symptoms that are that can be urinary tract infections or maybe not. Frequent urination definitely is one of the symptoms, but some people go frequently anyway. You might have an irritable bladder, or for whatever reason, go more often than others. So frequent urination when you have a UTI means more frequent than typically what you're used to. Bad smell of the urine definitely can indicate a UTI, but it can also be other things. If you've eaten asparagus, you know what I mean. So diet can affect the smell of the urine. Also, change of life. That's another example. So for those of you who might have entered into menopause, you might have noticed, not with everyone, but you might have noticed that your urine doesn't smell the same as it used to. Abdominal pain certainly can be a symptom, and burning when urinating, which is usually the most disturbing and obvious and irritating part of a UTI. This little interesting creature, you might think it's gruesome or you might think it's beautiful, but this is E. coli. And if you have a urinary tract infection, most likely it's caused by this E. coli, so 85% of urinary tract infections. And most of the time it's coming from the intestines. So that's why we're told, not to wipe from back to front when you do a number 2 in the bathroom. That's because you can end up spreading E. coli to the vaginal area, and then it can make its way up. And urinary tract infections can be caused by things other than bacteria, like viruses and fungi and parasites, but these are more rare, and I'm not covering that topic tonight. So your body has certain defense mechanisms to prevent UTIs. One of those is just your immune system, and that's going to differ for everybody. Someone who may have a weaker immune system, so just as an example, people who have diabetes tend to get infections more than other people. Urine pressure. So this is just a mechanical way, just by the speed and the pressure of your urine going through your urinary tract actually helps to push and flush bacteria that may be present through the urinary tract, and also the pH. So that is something that can help defend against bacteria. Having a slightly acidic urine is actually helpful. And I did want to mention, just going back to the E. coli bacteria, that we used to think once upon a time that the urinary tract was sterile, that there's no bacteria there, but even in healthy individuals, there can be. Our urinary tract is designed to prevent backflow, so everything should move one way if it's healthy and everything's working fine. Now, for the ladies, one of the defense mechanisms is just a healthy vaginal microflora. So the natural bacteria in the vaginal area is mostly acidophilus or lactobacilli, and this healthy bacteria, as the name implies, acidophilus, produces acid, and so maintaining a more acidic environment in the vaginal area is healthy. And also these bacteria naturally produce certain chemicals like hydrogen peroxide. And what that does is, if you can just imagine musical chairs in the vaginal area, it's a strange thing to imagine, but imagine you have a bunch of chairs there and there's only so many. And so if you have healthy bacteria and they're all occupying those chairs, then when other bacteria that shouldn't be there might try to make their way into the area, having this good bacteria can kind of take up space and keep them away. So with changes or disruptions in the normal flora there, this could make you more susceptible to getting unwanted bacteria that can then make their way up into the urethra and resulting in a urinary tract infection. Men also have their own sort of fighting substances secreted in the prostate. So that's why, even though this is about urinary tract infections, if you're prone to these UTIs, one thing to think about is how to keep a healthy normal flora in the vaginal area, as that is an entry point for UTIs. And there are certain types of probiotics, bacteria that we can take in a supplement form. These two particular types I'm listing here, Lactobacillus acidophilus and Rhamnosus, are both ones that are known to be helpful to prevent or reduce the occurrence of things like vaginal bacterial infections and candidiasis. So because of that, we think they're maintaining a healthy flora. So if you tend to get UTIs a lot, and maybe if you get vaginal infections, then taking a probiotic be something to consider. This one I'm showing you here is 100 billion. That's a very high dose. Typically, higher doses would be considered when you have an infection, perhaps, and lower doses can be taken at other times. So this is made up of 10 different types of bacteria, which that's what the 10 here stands for, but it comes in different doses, 100 billion, 50 billion, and so on. And now actually tests all of their strains to verify using a very sophisticated piece of equipment called the ribo printer. That, as far as we know, isn't found anywhere else in North America. And also these same bacteria in here are tested so that they are resistant to stomach acid, to bile, to enzymes, and other things that might otherwise disrupt them. So they're robust. Some myths about UTIs. I'm sure there's a lot of myths out there, but these are some as stated by Dr. Andrew Morris, a medical doctor who focuses in kidney and urinary tract health. So one of them is that any bacteria in the urine indicates a UTI. This is a myth. it might have been one that we didn't understood previously. As I said, that it used to be thought that the urinary tract was sterile. It used to also be thought that the lungs were completely sterile, but we're learning now that we do coexist without being in a disease state with bacteria. So even if you test positive as to having some bacteria, doesn't mean you have a UTI. UTIs are not sexually transmitted diseases. This is a myth, if some people seem to think that. UTI symptoms should always be treated with antibiotics. So that is a myth too. And I think more and more medical doctors are kind of buying into this new paradigm of, just because you have a UTI doesn't mean you need to get antibiotics, but that's their call in conjunction with you, of course. Now, these other two, that it's a myth that showering or going to urinate or cleaning the vaginal area after sex prevents UTIs, and that what you wear or what you do, so underwear, pants, bubble baths, and douches can cause UTIs. So Dr. Marr says these are myths. But my opinion about this is that they probably may be called myths because there's no studies on them. So, you're not going to take a study and have someone taking bubble baths to see if it causes a UTI. You're not going to have these things are probably not studied. So absence of evidence is not the same as evidence of the absence of these things being true. So since they're easy to do, I still personally would recommend them if someone has chronic UTIs, and especially if you notice it helping yourself. Do UTIs cause delirium? Once upon a time, it was thought that was the case because there were some studies in the past, although they're now considered that they're weak studies and they're biased studies, that showed an association between having urinary tract infections and having delirium, which is a series of disturbances in mental abilities. But other studies have suggested it's not the case anymore. And it was thought that, when somebody seemed to be delirious, and this was often a senior, and they were thought to have a UTI, that the reason the treatment for the UTI would reduce those symptoms of delirium, this is one theory, is that they may, in many circumstances, have been caused just by dehydration. Many elderly people are dehydrated, and that can cause you to be, just not yourself and kind of like delirious. And so they'd be put on an IV, and then they would seem better. And it was thought that it's because it helped with the urinary tract infection, but not the case. Anyway, a kind of interesting anecdote. What are some of the risk factors for UTIs? So I've listed a whole bunch here, and I've bolded the ones that, in some way that you may have more control over being able to affect. So I'm not going to talk about them all. Unfortunately, this is one of them. And if you're ill or in hospital, if you need to be on a catheter frequently, that is a risk factor. But diabetes is, for a number of reasons, maybe poor immune system, blood sugar levels being chronically high, so poorly controlled diabetes, sugar levels will be higher, and sugar is thought to feed the bacteria. Menopause, definitely, we're more likely to get UTIs in menopause. With drops in estrogen comes a thinning in the vaginal area. Just a change in the quality of the tissue makes it, you lose some of your natural defense mechanisms, which are part of the integrity of those tissues. Sexual intercourse, I think for obvious reasons, is a risk factor as well. Abnormal bladder emptying. So it's not a good idea to hold in your urine all the time. We should go to the bathroom when we need to. And for people who are diabetic, one of the problems is, again, if it's poorly controlled, is that they get some damage to their nerve endings. That's one of the long-term side effects of poorly controlled diabetes. that may mean that they are less sensitive to the fact that they need to go to the bathroom. And spermicides are a risk factor that can be found in different types of birth control, like diaphragms and condoms. Now, you can look up online or ask your doctor, because there are different types of spermicides, some thought to be more of a risk factor and some less. And you know, from what I've read a little bit of it, maybe even the weaker ones are more of a problem, because in the same way that antibiotics can cause resistance species, which is one of the reasons we call antibiotic resistance. We don't want to use antibiotics because they will kill off some of your natural bacteria and then leave some that are stronger and pathological to thrive. The same thing may happen when it comes to the spermicides. Now, drinking lots of water as a helpful tip, this is not a myth. So actually, a randomized controlled trial found that 140 premenopausal women who were all experiencing recurrent urinary tract infections, who drank less than 1.5 liters of fluid a day, so they were used in the study, and the UTIs became significantly less frequent when they drank more water for 12 months. So it was a whole 1-year study. So definitely stay hydrated. Drinking lots of water does seem to speed recovery. Urinate frequently or as needed. And I know when you have a UTI, often people try not to drink because it hurts so much when you go to the bathroom, but it will eventually make that peeing less painful because it's helpful, again, as I mentioned, because it's creating force and literally flushing those bacteria out. And I don't use the term flushing a lot because it doesn't sound very scientific, but in this case, that is what water is doing. So drink lots of water. I'm just gonna take a sip of tea here. Overprescribed antibiotics. So when it comes to urinary tract infections, in 2014, the CDC reported, so this goes a little bit way back, that UTI antibiotic treatment was avoidable at least 39% of the time. Wow, that's a lot. And that asymptomatic bacteria is insanely common, that's quite the word, in all age groups, and is misdiagnosed as a UTI more often than we want to think. So hopefully doctors now are more aware of the fact that you just have bacteria sometimes, and it doesn't mean you need a UTI or you need antibiotics. So I'm never recommending here that anyone goes against their doctor's advice, but if you have the feeling that maybe your doctor might be overprescribing antibiotics, my suggestion would be just to seek a second opinion. Some doctors may be old school, all doctors are different. Some doctors just may be more inclined to prescribe antibiotics and others less. So it's just something to think about. What happens when we take antibiotics, even once in a while, there is a huge reduction in the richness and diversity of the microbes that live in our gastrointestinal tract, in our vaginal area, and elsewhere, even in our mouth. And that we have a long way to go in terms of understanding more about a microbiome, but most experts would agree that richness and diversity is key to the proper functioning, and that's going to affect our immune system, and that includes our propensity to get infections. The risk of antibiotic resistant strains is one of the biggest issues with overuse of antibiotics. So here are just some examples. C. difficile is one of those resistant strains that can develop after taking antibiotics, and while it can just cause mild diarrhea if you're lucky, in some cases even death. So resistant E. coli, I mentioned E. coli is the bacteria that most often causes UTI. That can also occur from the overuse of antibiotics. Can change, of course, the way our digestion works. And here's an example of weight gain occurring after gentamicin, an antibiotic used for urinary tract infections. So I think, if you live and breathe, you know that you want to limit antibiotics unless you really need them. So backing into the benefits of probiotics, I've already mentioned this, but it's pretty standard now, even in mainstream medicine, to recommend probiotics if you have just been on antibiotics or are going on antibiotics. So don't feel shy about using them. And typically a high dose if you're going on antibiotics. And we know that probiotics suppress the growth of undesirable microbes and increase the abundance of beneficial microbes, alleviate the effects of antibiotics. They certainly don't reverse all of the effects, but they're a good start. So to me, that's an absolute must. You can take them at the same time as antibiotics, but just several hours apart. The antibiotics otherwise will destroy the probiotics, but the probiotics will not do anything to your antibiotics. And another supplement that's less well known is Saccharomyces boulardii. It's a kind of fungi, and this is well studied. There's 21 randomized controlled trials that were analyzed here on Saccharomyces boulardii, well known to help reduce the risk of antibiotic-associated diarrhea. So again, if you happen to be on or happen to be going on a course of antibiotics, you can think of Saccharomyces boulardii. Ask your doctor about this. Now, avoiding refined sugars when you have a UTI, we should always avoid too many refined sugars, of course, but definitely when you have a UTI or if you're prone to them. I didn't find specific studies like there. I don't think they're going to take people and make them eat a ton of refined sugars and see what happens. But we know that excess sugar feeds bacteria. These sugar thrive on bacteria like E. coli. Excess sugar is thought to suppress the immune system. And I'm saying excess here because I don't want us to be fear-mongering about sugar, but in excess, so it's going to be out and available in your bloodstream. In fact, vitamin C and sugar or glucose, when it breaks down, compete for the same sort of like pathway to get into your cells. And so if your blood sugars are very high, it's possible that you cannot get as much vitamin C into your cells, which is important for your immune system. And what's interesting is that this advice to avoid refined sugars is available and found on many mainstream medical websites for urology or urologists. So here are just two that I found that advice on, but if you keep looking, I think it's quite common. All of my clients that I remember who had a lot of UTIs would notice if they had a lot of sugar, it would flare up or get worse. Sorry guys, just gonna take another sip of water. Done a lot of talking today, so. I'm going to get into just a couple more of natural treatments. So D-Mannose is kind of a mainstay of a natural treatment for UTI. So I want to tell you a bit about it. This is what D-Mannose looks like, and this is what glucose looks like, which is, just a pure sugar that your body requires for energy. They look very similar. In fact, your body, and this is a supplement, D-Mannose you can get as a supplement, but your body can make D-Mannose from glucose and does make very small amounts. So it is something that's naturally occurring and found in the body. Now, why do we take D-Mannose for UTIs? Well, it acts as an anti-adhesive agent. So if you can imagine, this is a E. coli, this poor gentleman. We won't know that I'm calling him an E. coli, but I thought this was very visually helpful. So if you can imagine, so he is E. coli. The first critical step in order to get an infection of the urinary tract with the E. coli is it has to latch onto the walls of the urinary tract, just like he's latching on here. And so there has to be this connection, kind of like a lock and key. But if you can imagine, if we put something really slippery on these, like soap, then the E. coli wouldn't be able to grab on and would fall down and go along with all the water flushing through the urinary tract. So that is what D-Mannose is thought to do. It's an anti-adhesive agent. The D-Mannose will attach to these areas on the wall. And so instead of the E. coli attaching, it does itself. So that is how it's thought to work. D-Mannose is an inert sugar, meaning unlike our glucose, glucose gets metabolized, broken down, and used and finally for energy in our body, but D-Mannose does not. It has been studied and shown to pretty much be fully excreted, so we'll end up peeing it out, and therefore not something that you have to worry about in terms of raising your blood sugar from what we know. So D-Mannose is available as a supplement, and I will show you some of the studies too. This particular D-Mannose, by now, they have a few, but this particular one is unique in that it is certified organic. There are no other certified organic D-Mannose on the market, so that really stands out. Now, the health claim on D-Mannose is it helps reduce the risk of recurrent UTIs in women. So it does say woman. I think the reason that this is Health Canada approved claim, probably the reason for this is the fact that all the studies using D-Mannose are on women. What is a recurrent urinary tract infection? Since that's what it says, that it reduces the occurrence. So I just thought I better define what does it mean by recurrent. You have recurrent urinary tract infections. That means you're getting 3 episodes of UTIs with a positive urine, so actually testing it, culture, in the last 12 months. So 3 a year, or 2 episodes in the last 6 months. So that's how it's defined. Now, D-Mannose comes in different forms. So as I mentioned, there's the organic one, but so you can get it either as a powder or as a capsule. I don't have any, well, I would, no, that's not true. I do have a preference. My preference is the powder, but if someone else prefers the capsule, I don't have any issues with it. The advantage, though, of the powder, I will get to in just 1 second, but I think there is. So here's some tips for D-Mannose for use. One is that the claim on the bottle, like the Health Canada approved claim, is for prevention, but it is often used to treat them as well. So I don't see any issue with that. So even if you haven't been taking it, but you get a UTI, you can take D-Mannose, you know, regardless. Typically, if it is recommended for an acute UTI, say if you go see a naturopath or something, they're typically going to recommend a dose that's a little bit higher than what it says on the bottle. And that's based on the study. So it's typically dosed a tiny bit higher, 1 gram 3 times daily, based on 1 clinical trial. And another tip is if you're taking the powder form, it's going to dissolve readily into hot or cold beverages. So you can take it with a coffee if you want, whatever you like. I just wanted to point out, as I mentioned in the beginning, that we do now an average of 96 quality checks and tests on every single ingredient. So that is the case for D-Mannose as well. Here's a list of the tests that have been done on this. 62 principal quality tests that cover a huge range of things. Also, product identification, making sure that D-Mannose is what's in the bottle, heavy metal screens, looking for microbes, making sure it's not contaminated, etc. Now, one of the reasons I said that I do prefer the powder D-Mannose is it encourages water consumption because you have to add it into water. And so for that reason, because water itself is helpful, I do like the powder. Unless you're adding it into lots of juice, then it's questionable because then you're getting a lot of sugar when you have a UTI. And if you want to know what it tastes like, if you've never taken it, it's very mild. It's got a pleasant, mildly sweet taste with a slight hint of bitter aftertaste. Perfectly fine. I've never met anybody who couldn't handle D-Mannose. Very palatable. So I said I would show you a few studies. I won't bog you down in details, but this study, these are all clinical trials, was to see what happens in terms of prevention, prophylaxis. And it involved 308 women with a history of recurrent UTIs. They either took 2 grams, which is the dose here, of D-Mannose for 6 months every night in water, or placebo, or an antibiotic. And the results were that the symptoms, urinary symptoms, were less with those who were taking D-Mannose than those using the prescription drug. Also, when it came to recurrence of the urinary tract infections, 32% of the participants did have a recurrence, but only 15 of those were the D-Mannose users. 21 of them were the drug users, and 62 were those taking the placebo, which is what we would hope to see. Those taking the placebo are going to get more. So definitely, in conclusion, D-Mannose seemed to be useful for prophylactic, that's like a prevention for those at risk for UTIs, and can avoid the long-term side effects of antibiotics, including the development of resistance. Again, this isn't to override any of your doctor's advice, but for those of you who are feeling comfortable and your doctor's feeling comfortable and doesn't want you to take antibiotics or think it's warranted, then this can be a great choice. And here's another study, smaller, 60 patients with chronic UTIs and who had an existing UTI at the start of the study. They took either antibiotic or D-Mannose using 1 gram 3 times a day. They took it every 8 hours. That does remind me of an important point, which is studies show that if you take D-Mannose, all of it is eliminated within about 8 hours. A lot of it within a couple hours, but then the last bit 8 hours. So if you want to keep it continuously in your system, then every 8 hours would be an ideal way to take it. And the results were, we look at like what was the mean time for UTI to reoccur. So it took about 52 days before, on average, for recurrence of the urinary tract infection in those using antibiotics, but 200 days or 7 months on average for those using D-Mannose. And urinary pain and frequency decreased significantly as well. So those are another positive one. And then the last study I want to show you, this is because this is the only one I could find on using D-Mannose for an acute UTI rather than for prevention. This is a pilot study. It's certainly limited. They didn't even have a placebo. They didn't do a culture test. They just did it based on symptoms. But nevertheless, it was administered twice daily for 3 days, I would assume from the start of the symptoms, and then once a day for 10 days ongoing. And they did find a significant improvement in the majority of symptoms and concluded it was an effective aid for acute cystitis, which is the bladder infection management. So if you're asking yourself the question, can men use D-Mannose? Or if there's some men here that may be wondering that, because it doesn't say it on the bottle. Well, you know, I think absolutely. Again, Health Canada, they didn't, my guess is, didn't put men on the bottle because the studies are all on women. But, you know, as far as I know, there is, although there are some differences anatomically, you know, if you get a urinary tract infection as a male, I don't see why D-Mannose wouldn't work exactly the same way. And people do give D-Mannose to their pets, and I don't think then they care whether it's male or female. But UTIs are more common in women than men. And here is the reason. Now, this until about 50s or 60s, and then it seems to equal out. Not quite sure why, but the reason that it's more common in women is you see So most of the time, a UTI is caused by bacteria that comes in from the bottom up here, so not from the kidneys down. And as you can see in women, the urethra is very short, so the destination from the vulva, from the opening, if bacteria get in order to get up to the bladder, doesn't have to go very far, whereas for men, the bacteria enter the penis and it has a much longer journey, harder to survive. It's like hiking up. So that's probably one of the main reasons. There could be other ones, certainly hormonal, other things, the fact that women get, a lot of atrophy and menopause and such. So there could be other reasons, but that is one of them. D-Mannose and diabetes. So I have been asked the question before, can I take D-Mannose if I have diabetes because it's a sugar? Now, I already explained to you that it's inert, and that from studies it shows that just pretty much all of it is excreted. So Health Canada is confident enough that they don't put any warning that you cannot use it if you're diabetic on the bottle. But if you want to be super cautious, and certainly here was an article where I guess they were, super cautious about the very theoretical issues. Theoretically, D-Mannose could increase levels of glycosylated hemoglobin A1C. That's a blood test that's measured, especially if you're diabetic, to see how your blood sugar levels are over long periods of time. Monitoring of patients with diabetes is recommended. So, if you're worried, anyone who's diabetic already measures their blood sugars. You can easily see how it affects them and test it out. No harm doing that at all. Ask your doctor if you're concerned. How long can D-Mannose be used for? So studies have shown it to be safe up to 6 months. We just don't have longer studies, but Health Canada finds no reason to place a restriction on D-Mannose. Just again, understanding what it is, its simplicity, the fact that it's inert, that it's naturally occurring in the body. They don't place any restriction. And as I mentioned, now I'm not a pet doctor, but I know that many people use D-Mannose for UTIs for their cats and dogs. I don't know, perhaps other pets as well. You can look it up, you can ask your veterinarian, but that's definitely, I think, something that is used. Now I'm going to go away from D-Mannose, and we're going to talk about traditional herbal remedies that are used for UTI, and these four in particular. So one of them is uva ursi, the leaves of uva ursi, traditionally used, dandelion leaf, because you have dandelion root as well, juniper berries, and bachu leaf. Now, so these are all traditional. What they have in common is they're traditional herbal diuretics, meaning they help to increase the flow of urine out of the body. And so in that sense, it shouldn't surprise you that they may have some effect for UTIs, because I've already said that just drinking water is helpful. So these are all known to be diuretics, but some of them have other properties, as in antimicrobials. And there's not a lot of, I'm not going to go through clinical trials on them, but in addition to the history, there are some studies that do highlight or isolate certain components of these that are shown to have antimicrobial effects against bacteria and such. So a little bit more about uva ursi. It's traditionally used in herbal medicine in North America and Eurasia, and it's a mild diuretic, and it's been used to relieve symptoms of minor urinary tract infections. Dandelion leaf, you're probably all familiar with. You might have even eaten them. They're a little bit bitter. Dandelion root may work a little bit, but dandelion leaf has more of a diuretic effect, and also traditionally used in herbal medicine as a diuretic. Juniper berries, also known to have anti-inflammatory effects. And of course, part of the symptoms in a UTI is that you have inflammation. That's going to cause part of your symptoms. That's why all of the words that I described in the infections end in itis, which means inflammation. Bachu leaf is close to my heart because it comes from my home country, South Africa, and it has a long history of use there for different things, including urinary tract infections. It did get adopted in the 19th century in the United States, and it was traditionally used then for UTIs, but once antibiotics came about, it was just sort of forgotten and left behind. So here is a product called Water Out, and the Water Out implies that this product is a natural diuretic, which it is. It contains uva ursi, dandelion, juniper, and bachu, which I just mentioned. And what you notice here is that the uva ursi is standardized to contain, so it's guaranteed to contain 15% of this arbutin. So arbutin is a naturally occurring component in the uva ursi plant, and its metabolite, when it breaks down into a metabolite, which is what it breaks down into, it prevents bacteria from adhering to the urinary tract. So that reminds me a lot of D-Mannose. It's acting seemingly as an anti-adhesive. So it's nice to have that standardized amount. Also a little bit of vitamin B6 and potassium. The potassium, because if you're taking a diuretic, you can lose electrolytes. You don't want to, if you're taking diuretics too, like prescription diuretics, your doctor might have already told you that, or you might be aware of that, but we can lose a little bit of potassium. So it's just kind of compensating for that. This is the claim on the bottle. It says juniper, so it just refers to juniper. Juniper is traditionally used in herbal medicine as a diuretic and as a urinary tract antiseptic to help relieve urinary tract infections. I also just want to say, so this, not particularly this product, because we're talking like a long tradition of herbal medicine, but products like this or herbs like this, traditionally, herbal diuretics as a group, as a whole, have been used for a number of things, including UTIs, but they might have been used for other things as well, including, so for example, PMS. There's different types of PMS that have been categorized. This is PMS hyperhydration. So those who, when they have PMS, tend to be holding on to a lot of water, swollen hands, swollen breasts and such. So a product like this could be used under those circumstances as well. This product says for occasional use only, for use beyond 1 week, consult a healthcare provider. So it is intended for short-term use, and hopefully, that's just, if you have a UTI, it's just short-term. So this is not something to be taken for prevention of UTIs that you would just take ongoing. It should be restricted. Same with if you have, PMS, and if someone was using herbal diuretics, it would just be used for a few days to relieve those symptoms. I did want to review, because the risk information on this product it looks overwhelming if you look on the bottle, but if I break it down, it's not that much of a big deal. So I wanted to go through that with you. Every herbal product, pretty much, except echinacea, says don't use if you're pregnant or breastfeeding. So that's that doesn't mean anything, although I do suggest you listen to that. If you have a kidney disorder, so that's because juniper berry can be a kidney irritant. Again, nothing to worry about in healthy people and when you're taking it short term, but if you have an existing kidney disorder, that's why you probably shouldn't use this product. Don't use with other potassium containing supplements or salt substitutes. That's simply because it contains potassium already, and too much, you can get too much of a good thing. Now, consult your doctor prior to use. So this doesn't mean that you can't use it, but they suggest you, Health Canada suggests you consult your doctor prior to using this product if, and all of these different things here. So if symptoms persist or worsen, well, that makes sense. You don't want to leave a UTI that's not getting better unchecked. If currently using other diuretics, again, too much of a good thing. You don't want to take a diuretic if you're on a diuretic, or especially a prescription diuretic. That's a no-no. If you're taking corticosteroids, NSAIDs, or anticoagulants, consult your doctor. If you have a fever, painful urination, spasms, or blood in the urine, well, you know, they want to make sure that you don't have a raging UTI that's not responding, and you just consulting your doctor to make sure that you're using this under the right circumstances. If you have a liver, gallbladder disorder, or intestinal obstruction. So again, this sounds all very scary, but that's just a very theoretical issue, because this product contains dandelion, and dandelion is a natural stimulant to the liver and gallbladder. It may help increase the production of bile, which is sometimes that property is taken advantage of in detox remedies. But because of that, if you have an existing, especially obstruction, you don't want to stimulate those organs if there's an obstruction. So that's why this is here. It's not because otherwise that dandelion is dangerous for the liver or gallbladder at all if you're healthy. Stop use and seek medical attention if you experience, and it's listing a bunch of symptoms here. Again, they want to make sure that you don't have a raging UTI and you're just ignoring it. So that kind of puts it into perspective. I notice my time is a little past where I want to be, so I'm just going to go through this last part fairly quickly. So if for anyone who has chronic prostatitis, which is for men, a urinary tract infection in the prostate, there is a product called quercetin that actually has been studied specifically and shown to help with the symptoms of chronic prostatitis. And one of the studies added bromelain and found it to be additionally effective. So quercetin is something that you can find naturally occurring in different foods. And bromelain is a naturally occurring enzyme that comes from pineapple. So this combination can be used for chronic prostatitis. Here's the quercetin. So the actual claim that Health Canada has on the bottle is helps relieve the pain of non-bacterial chronic prostatitis. It does say to take with a meal on the bottle, and that's a good idea because quercetin is fat soluble, so it absorbs better with fat, so definitely with a meal. This specific one is anhydrous. That just means without water. The water's been removed. Most of the studies on quercetin are using the anhydrous form. And if you remove the water, it means you get more bang for your buck, more quercetin, more of that 400 milligrams is just going to be quercetin and not the water. There are other supports for the prostate that can also be used, but I won't go into too many details here. You can always come back and watch the presentation. And okay, there we go. So thanks so much for listening and attending. And I will take some questions and answers now because I went a little longer. So I'll just extend the time a little after an hour if you guys don't mind, so I can answer your questions. All right.